Thank you for joining me today. I'm Dr. Stephen Grinstead. I'm really excited because my new course with Psych Seminars is now online also. I have another live one coming up in May, on May 5th in Glendale, California. But if you don't want to wait till that long, or if you're not in this area, you can go to psychsem.com and then click on online course sign up and you'll find my course. I'm very excited about this. I did the first one on February 15th that they recorded, and you will have access to that. What's really nice about Psych Seminars is they break it into segments, and at the end of each segment there's a post-test question or two. You can always go back and review the videos. They'll tell you where the answers might be found, the video minute segment, and it's really easy. And with the online courses, you can go back over and over and over again. You only get credit once, but you can go back and review frequently. Why this course? Freedom from chronic pain and suffering. Well, it's because right now we have a big problem in this country. We have the chronic pain crisis and we have the opioid healthcare crisis. And what we need is to understand the synergistic problem and what it takes to create a synergistic solution. This 6-hour course will give you a lot of tools where you can help your patients who are suffering with chronic pain. Chronic pain is an overwhelming problem. You know, it's costing a lot of money. When this was published in 2011, this study, it was costing over $500 billion, and now it's closer to $750 billion in, lost productivity, medication, healthcare, emergency room visits, etc. And living with high levels of debilitating chronic pain starts impacting our cognitive functioning, and it leads to some big problems, including depression. It's an overwhelming problem, and the problem is sometimes these cognitive and emotional deficits don't show up for months or even years after the initial injury. But after a while, the brain just can't cope anymore. It's rewired, and people need more than just a biomedical approach to address that. You know, the biomedical approach alone doesn't work for people who have chronic pain and coexisting psychological disorders, including medication misuse, abuse, or addiction. And the research shows that about 20% of the chronic pain patients are utilizing about 80% of the healthcare dollars. And that's why the biomedical approach alone is not going to be effective with these people. So what do we need? We need something that instead of sequential treatment for these people, what I mean by sequential is they go to a pain clinic and get the pain management addressed here. They go to a mental health professional and get the depression, anxiety, or PTSD managed there. And if they have a substance use disorder, they go to yet a third person. That's sequential treatment. What they need is an integrated approach, biopsychosocial, spiritual, integrated concurrent approach that's targeted, strategic, and collaborative, with the patient being at the center of the bullseye. That's why I've spent most of my professional career developing the addiction-free pain management system. It is a synergistic, manualized approach for helping people with chronic pain and coexisting disorders. One of the things I will cover in the solution part of the workshop is the 7 strategic steps for freedom from suffering. So in the morning, we're going to take a look at the overwhelming problem, the obstacles that get in the way, and in the afternoon, we move into the solution. So it's time to wake up. What do I mean by that? Well, with people who are suffering with chronic pain, they go into what I call a chronic pain trance. It's a debilitating state of mind and behavior that robs them of quality of life, relationships, families, friendships, careers, and they need to wake up. We need to help them also explore their relationship with their pain and help them determine the difference between pain and suffering. Pain is a physiological signal that gets sent up to the brain. Suffering can be how the brain distorts or amplifies that signal over time. We want to help explore effective pain management. So a big part of this is teaching you some biopsychosocial spiritual interventions that we've proven effective for this population. Then we talk about the medication. The big question, to medicate or not to medicate? Well, that's going to be different for each individual. If there's a substance use disorder, they may need medication-assisted addiction treatment, and we need to be careful. The other thing is we need to teach them that there are some common stuck points. I've identified 6 common stuck points that people need to be aware of and learn how to overcome. And the last section I call Into the Beginning is where we teach people how to find balance and how to stay out of the problem and into the solution. And I always remind my patients that effective pain management is a right, but it's also a responsibility, just as freedom from suffering is everyone's right, and it's their responsibility. This frame says it all. If you focus on the hurt, you will continue to suffer. If you focus on the lesson, you will continue to grow. What an awesome message, and I firmly believe that. Pain's inevitable, suffering is absolutely optional, and we don't need to stay there. That message of hope can help people so much. So please join me online, or if you're going to be in the Glendale area on May 5th this year, please join me for a 6-hour live seminar. And if you can't do that, go online to Psych Seminars and sign up now. Thank you very much, and I appreciate you joining me today.